So in this video tutorial, we're going to talk about vaccinations in sexual health. There are, of course, 3 vaccinations that we offer routinely to certain groups. These are the hepatitis A vaccination, which we offer to all men who have sex with men, the HPV vaccination, which is for MSMs under the age of 45 years, and the hepatitis B vaccination, which carries a wider group of eligible patients. So this would include men who have sex with men, intravenous drug users, commercial sex workers, high-risk overseas contacts, and sexual assault. Now we use the box down here in our bloodborne virus screening to record these groups. So if you answer yes to any of these boxes, you should be considering vaccinations and testing for hepatitis. So these boxes on the right hand side is where we can record what's going on with the hepatitis screening. And I've now set it up so that the boxes here, here and here are summarized in the management page later. So if we complete them at this point, we can see on the management page where they've got to and therefore whether any further vaccinations are needed. There's also an information box here. The white boxes tend to be information boxes. This one's looking at vaccinations previously given at this service. So if you click on this box, it brings up this screen, and this will show you the vaccinations that we have prescribed. Of course, they may have had vaccinations at other clinics or even completed vaccinations elsewhere. But if you want to see when and which vaccinations were given within our service, you click on this information box here. So as I mentioned, these boxes are now summarized in the management page. So hepatitis A vaccination comes through here, hepatitis B vaccination comes through here, and the HPV vaccination, the offer and the number of vaccines given are here. Again, you have the vaccination history by clicking on this white box here, and if you want to look at what vaccinations we should offer and the schedules given, then you can click on the vaccination information box here. So clicking on the vaccination history again brings up the prescriptions that have been done within our service, the date and the type of vaccine given. And if you click on the vaccination information, it brings up this box which tells you about the schedules of vaccination. I've also now added in the timings that you can use if patients aren't attending at the appropriate times. There is of course some slippage which allows you to give the vaccines at a later time. These are now included in the vaccination information. So if we look a little bit closer at the hepatitis A vaccination status, you now have a number of options. So double click on this box and it will bring up these options. So this is kind of a summary of where the patient is with the vaccination. Now it may be that hepatitis A vaccination is not indicated or declined. Or it may be that this is a virtual consultation and the patient will need vaccination when they come to clinic next. So you could put needs hepatitis A vaccination. It may be that they've been vaccinated in full elsewhere and therefore you can complete previous hepatitis A vaccination elsewhere. Now in the HIV patients we do some hepatitis antibody testing. Now this won't be done within sexual health, but these boxes are there for the HIV patients. Now there are 2 schedules for hepatitis A vaccination, and if you use the standard schedule with the full dose hepatitis A, then you give 2 doses. One at 0 and one at 6 to 12 months. So if you're seeing the patient today and giving the first hepatitis A vaccination, you would put in their first hepatitis A, which of course includes today's. If it was a second dose, then you would enter that and then they are immune. We don't do any antibody testing to check response to hepatitis A vaccination. They just complete the course. Now there is the alternative course, and this would be for people also needing hepatitis B vaccination at the same time. You can give them Twinrix, but this is a 3-dose course given at 0, 1 and 6 months. Now this contains hepatitis B and hepatitis A, but the hepatitis A is at a lower dose because you're giving 3 vaccinations instead of 2. This really means that these courses of vaccination are not interchangeable, and if you start off on the Twinrix vaccination, you should complete Twinrix vaccination. And if you start off on the hepatitis A vaccination, it should be completed with a full dose hepatitis A and not with a Twinrix as a substitute. Looking at the box for hepatitis B vaccination, this is slightly more complicated because there is a number of variables here, and we look at antibody responses and they may need boosters. And of course we're testing for hepatitis B, so it may be that they've actually got hepatitis B, or that they've had hepatitis B in the past and cleared it, so they would have core antibodies but would be surface antigen negative. So this is past cleared hepatitis B infection. Again, it may be a virtual consultation, so you could put needs vaccination so that it's considered when they come to clinic next. They may already have been vaccinated, in which case, if they've got good antibody responses, you can put adequately vaccinated. Now, they may be somewhere in the middle of one of the different variable courses of hepatitis B, and then you can put currently being vaccinated. And then if you clicked on the summary, you can see where they are in that vaccination, if they've all been given by us. It's also possible that they may have completed their course of vaccination but need an antibody check at next attendance. So you can put vaccinated but needs hepatitis B antibodies. It may be that they've been vaccinated, the antibody levels are low, and they need a booster. So this can be highlighted for the next person seeing the patient in clinic as vaccinated but needs booster. And of course, some patients will get to the end of their course of vaccination and still not mount an adequate antibody response. These can be put as non-responders to vaccine. Patients, of course, have the choice as to whether they want to receive the vaccination, and so declines vaccination is another option. Now again, within the HIV service, we offer Fendrix as a further vaccination. So for some non-responders, they may require Fendrix, although a better vaccine and better immune responses, it may be that they don't respond to that, and there'll be an HIV patient non-responder who's also failed Fendrix. So patients who get to the end of the vaccination and haven't been responding need to be educated that they are susceptible to hepatitis B infection, safer sex practices, and they should be warned that they may need immunoglobulins if they have been in direct contact with hepatitis B. So the lower 2 boxes are for the HPV vaccination. One is for the offer. Now it may be offered but they haven't decided. It may be offered and declined. It may be offered and accepted. But if you give the first dose, you can put that in there. So you'd put offer accepted, first dose given. It may be that they're not offered for other reasons, or it's not known whether they've had the vaccination before. So the lower box is for the vaccinations received. So this includes the vaccination on the day given. So if it says first dose in there and it's the time for the second dose, you would give them the second dose and enter second dose in the box here. That way you can see where they are at that current moment in time. It's a 3-course dose of vaccination, so it will go first, second or third dose. Again, we're not checking antibody levels. Once they've completed the course, it's assumed that they're immune. So this is again looking at the summary slide on the management page, and this will show you that this patient has had their first hepatitis A vaccination, and you could check in the vaccination history to see whether they're due their next one, i.e. is it 6 to 12 months after the first, and if so, give it and change that to second dose. It shows that they are currently being vaccinated for hepatitis B. And again, you can see where they are in the stage of their vaccination process, looking at the history. And it may be that they've offered an undecided. So you'd want to check with them whether they have now made a decision, give them more information about the benefits of HPV vaccination. And if they decide they will have it, you can change this and give them the first dose, which you would enter here. So I've now updated the vaccination information. So by clicking on this box here, you get this information brought up. So this highlights that the course of hepatitis A vaccination is 2 doses given 6 to 12 months apart. However, successful boosting can occur even when the second dose is delayed for potentially several years, so the course does not need to be restarted if they've already received one. No matter how long afterwards, you can give them the second dose. With hepatitis B, the standard course is 3 injections given over 6 months, so 0, 1 and 6. However, there are more accelerated vaccinations if you're concerned about the ability to reattend or you want back protection quicker, you can give alternative courses. So the accelerated courses tend to be 4 injections. One can be given as 0, 1, 2 months, but then needs a booster at 12. But the super accelerated course, which we would probably reserve for sexual assaults or very recent high risk exposures where you want protection quicker and some back protection, then you might give it at 0, 7 days, 21 days, and then for long-term protection they would also need a booster at 12 months. Again, within this course, it doesn't really matter where you are. You can just resume vaccination. So if they had one vaccine 6 months ago and come in, you can still give them the second vaccination. So HPV is a total of 3 injections, which are given over 4 to 6 months. So that can be 0, 1 and between 3 to 6 months for the third dose. However, they may often be receiving hepatitis B vaccination at the same time, so you could just give them it at the same time, one in each arm at 0, 1 and 6 months, and that would cover both courses of vaccination. All 3 doses should ideally be given within a year, but can be given up to 24 months. So that was just a quick overview of vaccinations and sexual health. Hopefully you'll understand the courses of vaccinations better and the documentation better, and you'll be able to see from the summaries where the patient is at that moment in time. You'll be able to see from the information boxes what vaccinations have been given, and you can look up in the information box the schedules of vaccinations that are recommended. Thank you for your attention.